15 serious diseases discovered by gases. Have you ever realized that something as common as gas can be a warning sign of serious conditions? Have you ever wondered why their odor or frequency changes so much? What if these small signs were the key to discovering problems that may be developing silently in your body? Body gas isn't just uncomfortable. They are true messengers of your body's health. How can they indicate everything from simple food intolerances to chronic illnesses and even cancer? What's more, did you know that diseases such as diabetes, liver problems, and even rare conditions such as fish odor syndrome can manifest themselves through gas? Throughout this content, we will explore 15 serious conditions that can be discovered through gases. Stay until the end, as condition 12 is very common and few people know about it. Let's get started. How gases reveal diseases. Bodily gases are a direct reflection of what happens inside our digestive system. During digestion, bacteria present in the intestine process food and produce gases as a byproduct. When there is an imbalance in this process, whether due to food intolerance or a more serious health condition, the gases change in quantity, odor, or frequency, serving as a natural alert for the body. One of the most important aspects is the odor of gases. The smell can indicate anything from changes in the intestinal flora to the presence of toxic compounds generated by problems with the liver or pancreas. For example, gases with an extremely strong and characteristic odor may be a sign of bacterial overgrowth or poor nutrient absorption. In addition to the odor, the frequency with which gases appear is also important. Although it is normal to pass gas between 13 and 21 times a day, excessive amounts may be linked to food intolerances, such as lactose or gluten, or even more complex conditions such as irritable bowel syndrome, IBS. Another factor that experts analyze is discomfort associated with gases. When gas is accompanied by abdominal pain, bloating, or changes in bowel habits, it may be a sign of inflammatory diseases, such as Crohn's disease or ulcerative colitis. These symptoms should never be ignored as they may indicate chronic inflammation in the intestine. The texture and type of stool are also closely linked to gas production. Problems digesting fats, for example, can cause gases with a stronger odor and greasy stools, which may indicate pancreatic insufficiency. Thus, the detailed study of gases goes far beyond what one imagines, being a powerful tool in the diagnosis of diseases. Finally, gas can also reveal problems outside the digestive system. Metabolic changes such as type 2 diabetes or liver conditions can cause changes in gas. The body is an integrated system, and even these small signs can be the first step toward uncovering larger problems. Disease. 1. Lactose intolerance. Lactose intolerance is one of the most common causes of excessive gas and abdominal discomfort. This condition occurs when the body does not produce enough lactase, the enzyme responsible for digesting lactose, the sugar present in milk and its derivatives. Without lactase, lactose remains in the intestine, where it is fermented by bacteria, generating a significant amount of gas. One of the clearest signs of this intolerance is the increase in gas immediately after consuming dairy products. Symptoms often include abdominal bloating, a feeling of heaviness in the stomach, and of course, excessive flatulence. It is important to observe the relationship between the consumption of foods such as milk, cheese, or ice cream and the appearance of these symptoms. In addition to excess gas, the odor can also be an indicator. In lactose intolerance, gases tend to have a more acidic smell, a result of lactose fermentation by intestinal bacteria. Although not always noticeable, this factor can help doctors and specialists identify the problem more accurately. Another important aspect is the discomfort that gases cause. Many people report intense abdominal cramps or a feeling of bloating when consuming dairy products, which can affect their quality of life. These signs should be taken seriously, especially if they are recurring. Fortunately, lactose intolerance is a manageable condition. The diagnosis can be made with simple tests, such as the lactose intolerance test or the hydrogen breath test, which assesses the amount of gas produced after consuming lactose. Once confirmed, Treatment usually involves reducing or eliminating dairy products from the diet or using lactose supplements. Ignoring the signs of lactose intolerance can lead to bigger problems like malnutrition or imbalances in your intestinal flora. Therefore, if you notice an increase in gas associated with dairy consumption, see a doctor to investigate. Dealing with the problem early can greatly improve your quality of life and prevent future complications. Disease 2, irritable bowel syndrome, IBS. Irritable bowel syndrome, IBS, is a chronic condition that affects bowel function and often results in excess gas. People with IBS may experience recurring episodes of abdominal bloating, cramps, and flatulence, often without an apparent cause. These symptoms often worsen after heavy meals or specific trigger foods. The gases associated with IBS are the result of changes in intestinal motility and the fermentation of food by bacteria. Furthermore, the overactive intestinal nervous system in these patients can worsen gas production, increasing the sensation of discomfort. An interesting detail is that, in IBS, gases can vary greatly in intensity and odor. In some cases, they can be odorless, while in others they have a strong smell, depending on the food eaten. This can make immediate diagnosis difficult without other complementary tests. Stress also plays an important role in this condition. Studies show that people with IBS often report worsening symptoms during times of emotional distress, which directly affects gas production and digestive health. The diagnosis of IBS is made by exclusion, as there is no specific test. Tests are performed to rule out other conditions, such as celiac disease or inflammatory bowel disease. Identifying IBS can help the patient adopt strategies such as dietary changes, stress management, and the use of medications to relieve symptoms. If left untreated, the discomfort caused by IBS can harm quality of life and make daily activities difficult. Paying attention to the signs your body gives off, such as frequent and uncomfortable gas, may be the first step towards controlling this condition. Disease 3, celiac disease. Celiac disease is a serious autoimmune condition in which consumption of gluten, a protein found in wheat, rye, and barley, causes inflammation in the small intestine. Gas is one of the most common symptoms and often indicates that gluten is triggering an adverse reaction in the body. This condition occurs because the immune system attacks the lining of the intestine when it detects gluten, which impairs nutrient absorption. As a result, poorly digested food becomes fermented by intestinal bacteria, generating excess gas and a strong odor. Symptoms of celiac disease can include abdominal bloating, chronic diarrhea, frequent gas, and even fatigue due to poor nutrient absorption. In many cases, these signs can be confused with other conditions, such as irritable bowel syndrome, delaying correct diagnosis. A notable detail about gas related to celiac disease is that it is often accompanied by other signs, such as unexplained weight loss or anemia. These signs are important clues for doctors to identify the condition. Diagnosis is made through blood tests and intestinal biopsy. The only effective way to treat celiac disease is by adopting a strict gluten-free diet, which reduces inflammation and eliminates symptoms, including gas. Ignoring symptoms can lead to serious complications, such as osteoporosis and even intestinal lymphomas. Therefore, if gas is persistent and associated with gluten consumption, it is essential to seek medical help as soon as possible. Disease 4. Intestinal infections. Intestinal infections, caused by bacteria, viruses, or parasites, can generate a series of unpleasant symptoms, including excessive gas production. These pathogenic organisms interfere with the balance of intestinal flora, leading to abnormal fermentation of food and increased gas production. One of the characteristic signs of intestinal infections is the presence of gas accompanied by diarrhea and severe abdominal pain. Furthermore, the odor of gases can be particularly strong due to the production of sulfur compounds by the bacteria that cause the infection. Intestinal parasites, such as Giardia, can also cause gas. These microorganisms feed on ingested nutrients, leaving residues that ferment in the intestinal tract, worsening gas formation. This process is even more common in regions with inadequate basic sanitation or in people who have recently traveled to risk areas. Intestinal infections usually arise after consuming contaminated water or food. Although many of them are self-limiting, some may require treatment with antibiotics or antiparasitics to alleviate symptoms and avoid more serious complications. An important characteristic is the duration of symptoms. If gas persists for weeks or is accompanied by fever or blood in the stool, it may be a sign of a more severe infection that requires immediate medical evaluation. Treating intestinal infections not only reduces the discomfort caused by gas, but also helps restore the balance of intestinal flora, essential for good digestion and absorption of nutrients. Disease 5. Inflammatory bowel disease, IBD. Inflammatory bowel disease, IBD, which includes conditions such as Crohn's disease and ulcerative colitis, is characterized by chronic inflammation of the gastrointestinal tract. One of the most common symptoms is excess gas, a result of the inflammatory process and poor food digestion. In IBD, the digestive tract has difficulty absorbing nutrients, which increases bacterial fermentation and, consequently, gas production. These gases are often accompanied by pain, bloating, and changes in bowel habits, such as chronic diarrhea. A worrying aspect of IBD is that symptoms can range from mild to severe, with periods of remission and intense flare-ups. During these crises, gases can become more frequent and uncomfortable, impacting the patient's quality of life. The diagnosis of IBD is made through tests such as colonoscopy and stool analysis. These tools help determine the level of inflammation and type of IBD, allowing treatment to be tailored to each patient's specific needs. Treatment includes anti-inflammatory medications, immunosuppressants, and in some cases dietary changes. Controlling inflammation is essential to reduce gas formation and alleviate other related symptoms. If left untreated, IBD can lead to serious complications, such as intestinal perforation or an increased risk of colon cancer. Paying attention to early signs, such as persistent gas and abdominal discomfort, can make all the difference in early diagnosis and management of the disease. Disease 6. Liver problems. Liver problems, such as cirrhosis or hepatitis, can directly impact gas production. Although the liver is not directly linked to the digestive system, its role in bile production and nutrient metabolism influences digestion and intestinal health. When the liver does not function properly, bile production can be affected, making it difficult to digest fats. This incomplete process leads to the accumulation of waste in the intestine, which is fermented by bacteria, resulting in gases with a stronger odor and increased frequency. Furthermore, liver disease can cause changes in blood circulation, which affect the intestine. Portal hypertension, common in cirrhosis, can cause abdominal swelling and exacerbate gas formation. A characteristic sign is the combination of gas with other symptoms, such as jaundice, yellowing of the skin, fatigue, and loss of appetite. These signs are important to identify that the problem may be related to the liver and not just the digestive system. Diagnosis of liver problems involves blood tests, ultrasound, and, in more serious cases, biopsy. The approach includes lifestyle changes, medications, and, in extreme situations, a liver transplant. Recognizing abnormal gases as a possible sign of liver problems can help with early diagnosis and prevention of complications, ensuring a better quality of life for the patient. Disease 7. Pancreatic insufficiency. Pancreatic insufficiency occurs when the pancreas cannot produce enough digestive enzymes to process food. As a result, nutrients, especially fats, are not completely digested, causing excess gas in the intestine. The gases related to this condition tend to have a particularly strong odor and are accompanied by other symptoms, such as greasy stools or chronic diarrhea. This condition is a direct reflection of poor digestion, which allows bacteria to ferment food, remains in the digestive tract. Another important sign is the feeling of abdominal bloating after meals. Foods high in fat, such as fried foods and dairy products, can significantly worsen symptoms, as the weakened pancreas cannot cope with the digestion of these substances. Pancreatic insufficiency is often associated with conditions such as chronic pancreatitis, cystic fibrosis, or pancreatic cancer. In these situations, gases are not just a nuisance, but an indication of more serious problems that need immediate attention. The diagnosis is made through tests that assess the production of pancreatic enzymes, such as fecal elastase. In many cases, treatment involves the use of synthetic digestive enzymes to aid digestion and alleviate symptoms. If left untreated, pancreatic insufficiency can lead to malnutrition, weight loss, and other health problems. Identifying early signs, such as abnormal gas and changes in stool, is essential for effective treatment. Disease 8. Colon cancer. Colon cancer is one of the most serious conditions that can be associated with gas. Although it is not always the first symptom, excessive gas or sudden changes in its frequency and odor can be an important warning sign. This condition occurs when malignant cells begin to proliferate in the lining of the colon. As the tumor grows, it can interfere with intestinal transit, causing partial obstructions that lead to excessive fermentation of food and, consequently, an increase in gas. In addition to gas, other symptoms such as blood in the stool, unexplained weight loss, and frequent abdominal pain are often present. The combination of these signs should be evaluated by a doctor as soon as possible. Colon cancer can be diagnosed by tests such as colonoscopy and computed tomography. During colonoscopy, it is possible to identify lesions or polyps that can evolve into malignant tumors, allowing an early approach. Treatment varies depending on the stage of the disease and may include surgery, chemotherapy, and radiotherapy. Detecting cancer at an early stage significantly increases the chances of a cure and reduces the impact on the patient's quality of life. Therefore, changes in gas, especially if accompanied by other suspicious symptoms, should not be ignored. An early diagnosis can make all the difference in saving lives. Disease 9. Fructose intolerance. Fructose intolerance is a condition in which the body cannot properly process this sugar present in fruits, honey, and artificial sweeteners. This occurs due to a deficiency of enzymes in the small intestine, allowing fructose to reach the colon undigested. In the colon, fructose is fermented by bacteria, which generates a significant amount of gas. These gases are usually accompanied by abdominal bloating, pain, and in some cases, alternating diarrhea or constipation. A characteristic sign is the appearance of symptoms shortly after consuming foods rich in fructose, such as fruit juices, soft drinks sweetened with corn syrup, and sweets. This association helps doctors suspect intolerance as the cause of gas. Although the gas associated with fructose intolerance is milder in odor, its frequency and the abdominal discomfort it causes can be quite bothersome. The condition, although not serious, can affect quality of life if not treated properly. Diagnosis is made using a hydrogen breath test, which measures the amount of gas produced after ingesting fructose. A fructose-restricted diet is the most effective treatment to reduce symptoms. Identifying fructose intolerance early can prevent secondary problems such as chronic intestinal irritation. If you notice frequent gas after consuming fruit or sweets, it's worth investigating this possibility. Disease 10. Diverticulitis. Diverticulitis occurs when small pouches that form in the wall of the intestine, called diverticula, become inflamed or infected. This condition can cause symptoms such as abdominal pain, fever, and excessive gas, often accompanied by abdominal bloating. The gases in diverticulitis are the result of the fermentation of food waste trapped in the diverticula. This fermentation generates not only an increase in gas production, but also a change in the odor, which may be stronger due to the inflammatory process. During diverticulitis attacks, gas is often accompanied by other signs, such as constipation or diarrhea, as well as localized discomfort, usually in the lower left side of the abdomen. These symptoms can help differentiate diverticulitis from other bowel conditions. The diagnosis of diverticulitis is made using imaging tests, such as computed tomography, which identifies inflamed diverticula. Diet also plays a crucial role. During flare-ups, solid foods are avoided to reduce intestinal irritation. Treatment includes antibiotics to fight infection and, in severe cases, surgery to remove the affected part of the intestine. Ignoring symptoms, such as persistent gas and pain, can lead to serious complications, such as abscesses or intestinal perforation. If you notice a gas pattern associated with localized pain or changes in bowel habits, it is essential to seek medical evaluation. Detecting and treating diverticulitis early can prevent serious complications and significantly improve quality of life. Disease 11. Bacterial overgrowth in the small intestine, SIBO. Small intestinal bacterial overgrowth, SIBO, is a condition in which there is an abnormal proliferation of bacteria in the small intestine, causing excess gas, bloating, and abdominal discomfort. These bacteria ferment ingested carbohydrates, releasing large amounts of gases such as hydrogen and methane. People with SIBO often report gas soon after meals, especially when consuming foods rich in fermentable carbohydrates, such as grains, fruits, and vegetables. Bloating and a feeling of being full are notable symptoms that accompany the formation of gases. A characteristic sign of SIBO is the odor of gases, which can vary depending on the predominant type of bacteria. Excess methane, for example, can be associated with constipation, while hydrogen is more common in cases of diarrhea. SIBO is diagnosed using a breath test that measures the release of hydrogen or methane after ingesting sugars. This exam helps confirm bacterial imbalance and guide treatment. Treatment usually includes specific antibiotics to reduce excess bacteria and dietary changes, such as adopting a low FODMAP eating plan. These changes help control symptoms and prevent relapses. Identifying and treating SIBO is crucial to preventing complications like malnutrition and damage to the intestinal lining. If gas is persistent and accompanied by bloating or intestinal changes, investigating SIBO may be the solution to alleviate discomfort. Disease 12. Type 2 diabetes. Although it may not seem obvious, type 2 diabetes can directly influence gas production. The condition affects metabolism and can cause changes in intestinal health, including motility and balance of bacterial flora. People with type 2 diabetes often experience digestive problems, such as constipation or diarrhea, which can lead to increased gas. These symptoms are often the result of nerve damage in the digestive tract, a complication known as gastroparesis. Gastroparesis delays stomach emptying, allowing food to stay in the digestive tract longer, fermenting and producing gas. This can cause a feeling of bloating and frequent abdominal discomfort. Furthermore, the use of medications to control diabetes, such as metformin, can worsen gas production in some people due to its interference with the intestinal flora. The diagnosis of diabetes is made through blood tests that assess glucose levels, while digestive complications can be identified through specific tests, such as abdominal ultrasound. Controlling diabetes with a balanced diet, physical exercise, and medication is essential to minimize intestinal complications. If gas persists and is accompanied by other digestive symptoms, it is important to discuss it with your doctor to adjust treatment. Disease 13. Heart disease. Although it may seem unusual, heart problems can impact intestinal health and, consequently, cause excess gas. This is because poor blood circulation, a common feature of heart disease, can impair the functioning of the gastrointestinal tract. Heart failure, for example, can lead to fluid buildup in the abdomen, a condition called ascites. This accumulation can put pressure on the intestine, making digestion difficult and favoring the formation of gas. These gases are often accompanied by a feeling of bloating and abdominal discomfort. Additionally, medications used to treat heart disease, such as diuretics and beta blockers, can cause side effects on the digestive system, including increased gas. Changes in appetite and intestinal transit can also contribute to the problem. Another important factor is the relationship between heart disease and metabolic health. People with conditions such as obesity or diabetes, which are risk factors for heart problems, often have imbalances in their intestinal flora that lead to excess gas. If gas is accompanied by other signs, such as shortness of breath, chest pain, or swelling in the legs, it is essential to see a doctor immediately. These symptoms may indicate cardiovascular problems that require urgent attention. Maintaining a healthy lifestyle with a balanced diet and regular exercise helps not only with heart health, but also with the functioning of the digestive system, reducing the gases associated with these conditions. Disease 14, chronic stress. Chronic stress has a profound impact on the functioning of the digestive system and can be a significant cause of excess gas. When we are under constant stress, the body releases hormones such as cortisol, which directly affect intestinal motility and the balance of bacterial flora. A common consequence of stress is irritable bowel syndrome, which, as we have seen, is marked by frequent gas, bloating, and changes in bowel habits. Additionally, stress can slow down digestion, allowing food to ferment longer in the digestive tract. Another factor is the tendency to consume less healthy foods during times of stress. Processed foods, rich in fats or sugars, can worsen gas production due to their difficult digestion and impact on intestinal flora. Gas caused by stress is usually accompanied by symptoms such as abdominal discomfort, nausea, and a feeling of bloating. These signs may be more intense in people who are already predisposed to digestive problems. Managing stress is key to reducing related gases. Techniques such as meditation, yoga, and regular exercise can help regulate the nervous system and improve gut health. If stress is not controlled, it can turn into a vicious cycle, worsening digestive symptoms and impacting quality of life. Recognizing the connection between mind and intestine is essential to maintaining balance. Disease 15. Fish odor syndrome, trimethylamminuria. Fishy odor syndrome, or trimethylamminuria, is a rare metabolic condition in which the body cannot properly process trimethylamine, a substance produced during the digestion of choline-rich foods such as eggs, fish, and meat. As a result, trimethylamine accumulates in the body and is released through sweat, urine, and gases, causing a strong and characteristic fishy odor. Although the most striking symptom is the smell, gas production is also present and can cause great social discomfort. This condition is caused by a genetic mutation that affects the function of a specific enzyme in the liver. People with trimethylamminuria usually have normal digestion, but the odor of gas and other bodily fluids is abnormally strong. Although trimethylamminuria is not a dangerous condition, it can have a significant impact on self-esteem and quality of life. Dietary changes, such as avoiding choline-rich foods, help reduce symptoms. Diagnosis is made through specific urine tests, which measure trimethylamine levels in the body. In some cases, supplements and medications can help manage the condition. If your gas has a very distinctive and persistent odor, seeing a doctor may be the first step in identifying and managing this rare but treatable condition. These 15 examples showed how something as seemingly simple as gas can be a warning sign for a variety of conditions, from common digestive problems to serious illnesses. Paying attention to what the body communicates is essential to take better care of your health and seek medical help when necessary.